right? I think that's very, very important, that we need to find way in the global health to ensure that those people that do not necessarily have the title of professors and others, but doing a good work, and that can also generate knowledge, needs to come into this. There's a lot I could ask, but I think I would like to pick up a couple of questions from here. Here is posted by Professor Koblenz from the main chat. Says that why do you use the global health when in actual sense this program is biased on diverting local communities in developing countries from use of indigenous models, right? From which all members, let me see, in the globe can learn from. We need a global health curricula that builds on what is already believed in locally without imposing our own biased ideologies. So this is the point that is being raised. I'm sure that, yeah, why do we actually, allow this? Why should we not use the local based knowledge? And why should we shy away? Because, there are so many interesting ideas, but because of, the formal education system, these ideas have been usually looked down upon, actually. So the point here is, why do we use the global health system in actual sense? So in other words, how do you promote these indigenous and ideas? And I think actually, Peter, I've already touched on some of these issues, actually, unless you do want to, add anything to that.
No, I think this issue has been answered, and
Yeah.
I'm in total agreement that
Yeah.
one, we cannot prescribe.
Yeah.
We need to allow for alternatives, and global health is also local and needs to understand the context. So
Yeah.
I agree. Thank you.
Okay, great. And then the another point is that, of course, we are talking about all these issues. Of course, you cannot do this alone, and you need the stakeholders needs to be engaged in effective process, actually, to decolonize the curricula. So, which stakeholders do you think should be involved in this process? Dr. Burgess, what do you think? Which stakeholders should you be involved in this?
Yeah, thanks. Got unmuted just in time. I think that if you're thinking about Northern institutions, it's really important that there is engagement with people within high enough levels in the system so that you can create an incentive structure for people to engage in these practices. Because what typically happens is that you will get people who are already sensitive to the importance of power, critical thinking, local knowledge, power sharing to do some of the teaching in line with these principles. But if it's not embedded into systems of how people across an institution are evaluated, how they sort of move up the ladder of the academy, then you don't actually you don't make sure that that becomes an even process across an entire institution. You will get sort of silos. And I think it's also really important that some of the big institutions who sort of connect to these ideas of global health and have huge funding behind them to do that kind of global health practice really need to be stakeholders who are engaged in that process because, and I think it sort of comes to that previous question of, why do we use this term, even though we know local knowledge is more important and more valuable, etc. I think one of the reasons we use this term is because it is currently the logic that organizes all of our efforts. And dismantling that logic doesn't happen overnight. So you are working in that system. And how do you then work within that system and change that system while you're participating in it? I think becomes a much more important question. We could, on a small scale, start to sort of say, well, I refuse to participate in that.
Mm.
And that would be great. And then you would sort of get sort of slow knock-on action. But I think there's also an importance of acknowledging that within those big spaces,
Mm.
that because of historical inequalities in how systems are set up and where power sits, have more access to resources.
Mm.
That logic is operating the system. You need people inside that system to disrupt that logic,
Yep.
because that also then contributes to this wider project of change. I think, and I think that there sometimes are pluses to global health. One of the things that I think is nice about global health is that when it's done in ways that are critical, it attunes us to the way that our systems are interconnected.
Mm.
And I think that there is sort of like a mutual responsibility that sort of we have to each other globally for thinking about how actions in one part of the world impact on others and vice versa.
Mm.
And the problem with global health is that there's not enough of a dialogue that happens. It's more one directional, like Peter sort of has been alluding to with it,
Mm.
the whole conversation that, it's thought of as like something you go and do out there,
Mm.
and not that it's something that can inform us going back. And so it's been really interesting in the UK to hear more and more people talking about actually what can sort of community models from different parts of the African continent or Latin America teach us about how we can sort of drive community action and supports and programming in the UK,
Mm.
where there are huge sort of barriers and blocks in health systems, particularly for people from marginalized communities. And I think that thinking about that dialogue and the importance of that dialogue becomes really important.
Mm.
And one of the things that I always think about that I find so and really encapsulates the problem with global health for me, I suppose, or one of the sticky points, is the term reverse innovation,
Mm.
which I hate that term. I hate that term
Mm.
because it's the idea that like innovation that is coming from outside of the North is backward or reverse. It's
Yep.
just like a weird language that sort of shows you some of the challenges that we're still dealing with and why so much work still must be done within by people within
Mm.
those sort of northern institutions where a lot of power, for not without trying, I suppose, still exists.
Yeah. I think this is fantastic, and you touched on many things, and I think they also connect with Dr. What's point of social determinants, right? So really, if you really want to bring these people together to have an equal part, then the social determinant part needs to also be taken into account. And really, I mean, I agree that most of these issues actually, poverty, as Peter mentioned, is sometimes an underlying issue that makes this decolonization become difficult, because people are coming with bag of money. Usually, they do have the power to determine what should happen. So the poverty aspect part is so important, that we need to address in order to move forward. I don't know whether, Peter, you want to have, but there is also a nice, interesting question in the chat, that is there a risk that listening to society become populism? Is that a problem or an opportunity, right? Are we, if you listen to the people or to the society, are we risking it or not? Any thoughts on this?
Well, if you don't listen, then what are you doing?
Yep.
Because what is the purpose? It's first of all, global means many, and it also means bigger. And a lot of these institutions also public or publicly funded. So
Yep.
you can't just operate
Mm.
from the old ivory tower
Mm.
of we know it, they receive it, it just doesn't work. I always say that for me, essentially, this is why we wrote a paper on decolonize ourselves, because I don't want this narrative of them and us. It is what is the goal, and we look at all systems everywhere. So I always say that for me, my work in global public health, I learn a lot from communities, and and I think it is so important that we don't. In fact, if we don't listen, we get lost, and we live then in a vacuum. And then this is why these newspapers are writing. So, okay, you've produced this, so what? Why aren't you solving anything? So I think you have to keep your ears. And I'll tell you an example in Makere, the Uganda, the government is giving us money for Makere, over $10 million a year. We call it the Research Innovation Fund, and folk have to compete for it. But the government is coming and say, what problem have you solved? So there is an expectation, otherwise you not receive the financing. And so it takes listening, sieving, and then designing and delivering, and then continue to listen.
Thank you so much. I think that's, yeah, you've just basically made it very clear the need to just listen to society, right? Of course, you need to hear all the voices within those societies. So I cannot agree with you more. There is a very nice point from the chat that awareness is a tricky thing. We might be aware, but not empowered to speak up. So many times in global health, donors will bring projects, and when you assess their project, you just know it won't work in your particular setting, but money has already been received, political agreements made. Speaking up would just make you the noise maker and might lose you a much needed job. So I think systems of power and finance needs to be changed along with the system of knowledge. And I think the power thing is very, very important because it's also already been coming up. So now you have 5 minutes. I think this has been a very, very interesting discussion. Many areas, very practical, tips has been given both for decolonizing from the northern perspective and also, decolonizing from the southern perspective. And I think because of that, I think that you've made a very, very important point. For instance, they need to teach power in schools. They need to also create awareness, particularly among those that are privileged, who are actually continuing to do that. They also need to be trained. You need a long-term project that can help us to basically ensure that you create a good environment to be able to educate, particularly the next generation about this topic. And also, more importantly, to working on solving the issue that has to deal with the social determinants, that usually which is the driver about this. But just because I know that you have 4 minutes left, I would like to hear from Dr. Burgess in a very short terms. What message do you want the audience to take home?
I think if there was one message I'd like to ask people to hold on to is that decolonizing systems like curriculum and the wider global health system is a process that occurs over time. And sort of picking up on that context or that last comment that you read, Prof, I think it's from Isabel about awareness and the problem of being the troublemaker, is that the ways in which you contribute to that project over time might look different depending on people's own proximity to different types of power across their lifetime. And one of the things that I put a link to a paper where I reflect on this, because when you're a young scholar, you feel it so acutely, the problems with the system that you want to change, and feel like you don't have the safety to do it. But there are mechanisms that you can participate in that will contribute to this wider project in ways that are safe for you. And as you move along your career and are at different levels and different stages and different locations in the global health infrastructure, what you do changes. What I do now is very different than what I did 10 years ago. It looks because I'm different and I have a different location in the infrastructure and the system. And so I think, yeah, I think, criticality, awareness, and sort of a commitment to a long-term goal of decolonization would be my takeaway, I suppose.
Thank you very much. And Peter, what would you want these people to take home?
No, I think for me it is this discussion has to continue with institutions, wherever they are, to be self-aware, both as institutions, but also individuals, and to have the room to be uncomfortable with the present. We need to start with simple things that can be done now, and then advance this in the long term. And in the end, I think a toolkit or guideline is going to be important, that we check ourselves on that. Are we being fair and just? Is this going to make a difference? And are we practicing what we are speaking? I think those are some of my takeaway. Thank you.
Thank you both very, very much. And I think that actually, I mean, this is such a wonderful platform, and that is the European Global Health Research Institute Network. I mean, this is, almost involving the biggest global health institute in Europe. And I think that they do have the opportunity to really also play a role, because many of these curricula you are talking about actually developing by this institute. So that also means that this institute need to really take these issues right from the beginning. I mean, the issue that you talked about, for instance, how do you actually ensure that people understand power right from their training, from the beginning, right? So I think that, the network can really work very hard to ensure that some of these issues that is being discussed, now is a lot of low-hanging fruits that can be tackled right from now. And I think that with this, we're going to certainly help the network to also to look at their own practices. I mean, I would say that it is not a blaming game. This is basically looking at it very, very objectively and see where we can make a difference, right? In the end, it's a win-win. So I would like to thank the European Global Health Research Institute Network for really bringing this very, very important topic for discussion. And I think that this is the beginning. There's a lot that needs to be discussed about this, and both the speakers have actually touched on that. You should not stop here. You need to continue to do this. So you need to find a way of actually doing this, and probably not only on this platform, but also very other important platforms as well, so that we can really start working on decolonization. Because I think, we need to start, right? We cannot continue talking, but we need to really start, basically taking action, or really beginning to, to walk the talk, as people say. So thank you all very, very much, especially also for those people that have made time to join this. There's a lot of people who joined this. I think it's almost up to nearly 70 to 80. So there's a lot of interest. So I thank also those people that were behind that, organized it, especially Dr. Alberto, and also Dr. Frank Koblenz and the team. And also Jorlene for making this program possible. And I'm sure that there will be an opportunity for us to be able to continue this discussion. So thank you all very much, and thank you for coming. Highly appreciate it. Thank you. Thank you.
Thank you. Bye-bye.
Bye-bye.
Thank you.
Thank you.